So now I have my supplies gathered. I have alcohol. You're not going to want to use ChlorPrep for any infant under 3 months, and you're not going to want to use ChlorPrep at all for this procedure because of the way it interacts. So I have a bunch of alcohol swabs. I have a bunch of 2x2s. And then I have my lancet. So lancets come in two different sizes. They come in this kind of preemie purple, and they come in the green. If at all possible, use the green, unless your child is really, really small. I always have a spare with me in case I need to do a second puncture. I'm opening up my lancet. I also have my tube. This is a PD tube, and you'll notice it has like a little scoop end, and we're definitely going to need that. I'm also going to need my lab slip. So my baby has been warming, and I'm actually going to switch and use this fake foot because it's a little easier to do. But for the actual stick and for the holding procedure, I will use this doll. But he's got this weird foot thing, so it's going to be really hard to use. But the motion that I use is kind of like this, and I'll show you it on the fake foot. But what you want to do is be careful not to work way uphill, because then you're going to have trouble getting blood flow. So you're actually going to try to work as low down as possible and kind of massaging the blood out of the leg. It doesn't take long for kids to run out of blood. So if you have their foot way up here, because it's easier to see, you are actually going to at some point get less flow. So I'm going to move this baby out of the way and show you here on my fake foot. So my holding position looks like this. So I've got kind of my forefinger up, my thumb at the bottom, kind of encircling around, again trying not to move upwards. I'm going to go ahead and open up several of these alcohol prep pads and kind of lay them in a pile. I'm going to have my fluff tags. I'm going to be wearing gloves. I have my lancet. I'm pulling off this guard, and inside of this is a blade. I have my spare as backup, and I'm going to go ahead and open up my tube. So with gloves on, with my baby swaddled, sucrosed, somebody holding a pacifier in, I'm going to clean the foot with alcohol. So my area of insertion is going to be on the sides or the bottom of the heel. So not like the side, but kind of along the edges of the heel. You can kind of see maybe where I've stuck this poor foot before. And this is very typical because your baby will probably have been stuck before. So you're going to find a spot that hasn't been stuck. So I'm going to lay it flat against the area where I'm going to go, and I'm going to push the white lever. It's going to leave a little hole. The baby will probably cry. I'm going to wipe the first drop like I would for like a blood sugar, and then I'm going to squeeze, and I'm going to try to drip the blood without really scraping. The scraping is going to cause it clot, to hemolyze. So I'm really hoping that I can just get these drops to drip in. I needed to pass this first line. So you need it over the first line, or lab will send it back. Ask me how I know. Again, trying not to do this where the foot's way up high. Kind of do the hokey pokey, kind of let it all run down and keep going. If your blood stops or it gets really smeary, you're going to re-alcohol. Because once it gets kind of smeared all over it, it's hard to get it to big drops. Wipe that first drop off and keep going. The alcohol can also help keep it flowing, so it can help break off the clots. The other thing you can do if you stop getting blood is perform your second lancet next to it, and you can go kind of back and forth. You do want to get this pretty quickly or it will clot, and lab will make you recollect. So generally if you can get this done in a few minutes, your chances are better. Once you get it past that line, you are going to get your lid on. you are going to put the lid on very securely and hold it as you invert back and forth and back and forth. You're then going to scan the patient and the lab. Your slip may need to be flagged on. Go on a PD tube. So you may need to do it like this and then scan it and then flag it back on itself. And then lab will unflag it to scan it on their end. But that really is the only way you can get a lab label on a tiny tube, is to do that. So at that point, I'm then going to apply a Band-Aid or a piece of tape with a clean piece of gauze, make sure my baby's all cleaned up and ready, and take him or her back to mom or dad.